We know from history that there have been apocalyptic pandemics. What we don't know is whether we are facing another one. But we do know that the round-the-clock coverage of coronavirus is fanning a global panic. It's the scary language. A deadly virus, a catastrophic illness, comparisons to nuclear bombs.
New Rochelle is ground zero as the coronavirus infects at least 11 people.
Then there's the body count, with a focus on the U.S.
The 11th fatality announced today.
Even the reality is made to sound earth-shattering. While the virus is clearly spreading quickly, ABC used the same anecdote 3 times inside of 3 minutes to make a point.
His wife, 2 children, and neighbor all testing positive. His wife, 2 children, and a neighbor all testing positive.
His wife, 2 kids, a neighbor who drove him to the hospital testing positive too.
There's also the constant focus on what to do. Don't touch your face and learn how to wash your hands. Here's a helpful video from the New York Times.
Front to back over the back of the other hand.
Still, we're starting to see some pushback that fear rather than facts are driving the coverage.
We have a bigger problem, which is a fear pandemic. And the anxiety here is outpacing the reality of the situation.
But that message is also getting muddled now that coronavirus has become politicized, with complaints that liberals and the liberal media are fanning the flames to hurt President Trump.
Now, it's not just the Democrats who are recklessly politicizing the coronavirus threat. Their media lapdogs are at it as well.
Stick to the facts, ma'am. Just the facts.
Yeah, I mean, I'm not buying that the liberal media is fanning the flames to hurt Trump. One of the things that has really bothered me about this is the perspective. I mean, 18,000 people have died this season of the flu, 36,000 last year. In the U.S. and we're talking about less than a dozen people, or about a dozen people now. And it's like, you see the run on the grocery stores, all the product, but people canceling.
Try getting hand sanitizer. No hand sanitizer.
People canceling their flight. I mean, I'm not saying that the media should not be reporting it, of course. And we still don't know the origins. We don't really know that much about it. But I think I thought Governor Cuomo used a good term, a fear pandemic.
You know, and I think to some degree you're right. I want to show you just an example of some foreign press coverage. This is not U.S. coverage, foreign press coverage of the New Zealand Times or Herald. Now, here's first New Zealand coronavirus case. Pandemonium. This was sent to me. This was just a few days ago. And panicked shoppers last night descended on supermarkets, stocking up for what one labeled the apocalypse. All right. So this is the kind of coverage, and this is the largest newspaper in New Zealand. So, and if you go to the websites of either the New York Times or CNN, there is a lot of coverage. It's all focused on either a little bit on the presidential primary, the rest is on coronavirus. I would give the media a little bit of high marks. Recently, last night, there was a CNN town hall where they spent an hour. Dr. Anthony Fauci, I don't think was very good at explaining. He's supposedly one of the administration's top people. He's been around for a long time, used a lot of technical jargon that I thought was difficult to understand. CBS and NBC are also going to do 1-hour specials. I think the big wrinkle is social media. There have been so many rumors, I mean, how many of you saw this viral post this week that said the CDC recommends that all men shave their beards because a mask won't fit? Well, not true. PolitiFact, I think, did a great job of debunking it. Now, last thing I'll say, go to the CDC website. It's pretty darn good.
I think as somebody who covered a lot of the local reaction to prior
SARS or West Nile,
I can say I think what's been missing maybe a lot is context. I mean, you talked about the flu, H1N1. How many people died? You have any idea?
None.
Hundreds of thousands. I think almost 300,000.
In the United States?
No, worldwide. But that's still, by comparison to even China.
But this is just getting going.
That's right. Well, I think that there is the fear, and people want to do something. And also, I think there have been conflicting messages from the administration as how bad or that it's just a bad flu, or it's really worse than that. And I think that also has gotten people a little bit panicky, and certainly the media picks up on that. And
somebody just interviewed 2 people who actually had the disease, which I thought was interesting because they described what it was like, and it was like a flu. I mean,
I think part of the problem, too, is that this is a formula, and I've talked about this before, how local news, even national news, there's certain stories that we cover in a certain way, and it's usually scare tactic that's part of it. During sweeps times, that's when a lot of the rates are set for television stations. There's always a story or a series that talks about, 5 things that could kill your kids in the playground, or something like. It's never 5 things that your kid will make your kids happy. It's always something that will scare people into watching. And so that, with that sort of context for how we cover stories, this folds right into that. The other thing, too, there's sort of this clock that's being kept, and every day we have to say yet another person, as opposed to moving on to other stories. And then you have local radio station has a new jingle. They use My Sharota, that song, call it My Corota. Every time every time that's from the 1970s. It's a spoof. It is a spoof, but they do the jingle, and let's tell you about the latest cases. It just feeds into this hype that's going on right now and gets a lot of people upset.
I'm glad you mentioned things that feed into the hype, because we all have, the way media works now, the way that we're all connected on social media, we all have a role to play in terms of not being part of the problem. I definitely had a tendency early on to, every time there'd be a report of, okay, here's a new person, or President Trump says thing X, which is factually untrue and potentially dangerous, my impulse was to tweet it out and oh my God, or do a scream emoji or something. But that you become part of a node in this negative spread of people freaking out in a way that, by the way, I think I'm more worried about this than you are.
Yeah.
But we can be suitably concerned. Yes, it's also
one of the editors at ABC
deadly
said
virus.
that they're cutting out words like deadly and catastrophic. And how about ground zero? I mean, just say what it is without that kind of.
The other thing I would urge anyone watching at home to do, and I've really been working at this, is find some health journalists who specialize in this stuff, who really, really know what they're doing. I hope I get her name right. Helen Bramwell at STAT here in Boston is one of the people who I've been following, people who are appropriately concerned when necessary, but not inflammatory for the sake of getting close.
As my doctor said this morning, what we're doing, washing hands, using sanitizers, is what you'd be doing every season for the flu.
For the flu, absolutely.
Hopefully, you're hoping that the pendulum doesn't swing the other way.
We're going to run out of water if everybody washes their hands for 20 minutes every time. Come on.
Then we can scare people about that.
Scare people about that.